Hi, I'm Atlanta dentist Andrew Kokabi of Brookhaven Family Dentistry. And as many of you might know from watching some of our other videos, here at Brookhaven Family Dentistry, we take a very minimally invasive and conservative approach to dentistry. We don't want to give you any dental work unless we feel that you truly need it. And with some dental procedures, you know that you need it. For example, if you break a tooth, you know you need to get it fixed, or if you're having a toothache, you know you got to get it dealt with. But with other dental procedures, in particular, night guards and grinding and clenching, you're kind of dealing with the invisible. A lot of times you don't know that you are doing it or not. It's kind of like when you take your car to the mechanic for an oil change, and you know it's been 3,000 miles, so you need an oil change. But then they start talking about air filters and other stuff that I've never heard of. And you start wondering, do I really need this stuff, or are they just trying to upsell me? And so with night guards and grinding and clenching, there's a lot of gray area. Not all wear and tear on people's teeth is equivalent. For example, if you're a 53-year-old individual with a medium amount of wear and tear, that's much different than a 23-year-old person with the same amount of wear and tear on their teeth. And maybe at other offices, they pressure you and say, you are definitely grinding and clenching and you must have a night guard. That's not how we do things here at Brookhaven Family Dentistry. So this is how we go about determining if you need a night guard or not here at our practice. Of course, there are those cases where I see someone and I say to them, okay, I'm almost 100% sure you're grinding and clenching and you must have a night guard. But most of the time, that's not what I'm saying to people. Most of the time, if I see signs of grinding and clenching on your teeth, for example, some wear and tear or some gum recession, which, believe it or not, is actually a sign of grinding and clenching sometimes, then I have a nice long talk with you. I ask you a few different questions and I probe a little deeper. I ask you if, for example, when you wake up in the morning or in the middle of the night, do the muscles of your face feel tense or sore as if you've just been going to town all night on your teeth? Or does your spouse ever tell you that they hear noises of you grinding and clenching in the middle of the night? Do you ever catch yourself in the middle of the day with your teeth clenched shut? So we have this talk, and if you say to me, oh yeah, I definitely noticed those things, then I say to you, okay, you should have a night guard because it sounds like you're definitely grinding and clenching. But if you say to me, you know what, I'm not really sure, then instead of recommending a night guard for you, I'll say to you, well, let's do this. Let's give it a couple months. And during these next few months, I just want you to be mindful of the things that we discussed. Pay more attention to when you wake up in the morning or in the middle of the night. And let's touch base at your next visit. Often, we'll have people come back to us and say, hey, you know what? Before you mentioned these signs to look out for, I didn't really know if I was grinding or clenching. But now, yes, I'm definitely doing it. And in that scenario, great, we'll make you a night guard. But if you come back and you say, no, I haven't really noticed those things, then often we'll just chalk it up to maybe you used to grind and clench, but you no longer do, or we'll just pay more attention to it and keep checking you every few months and touching base with you. So that's how we do things here at Brookhaven Family Dentistry when it comes to dealing with a invisible problem such as wear and tear on your teeth and recommendation of night guards. I've got another video that goes a little deeper about how we make your night guard and what we do afterwards to make sure that you're happy with it. But for now, thanks for taking the time to check out this video. And if you are here in the Metro Atlanta area and you're looking for a dental office that takes this less aggressive and more conservative approach to recommending dental treatment, then I think we'd be a great fit for you.